OSHA compliance for medical staff. Creating a safe and compliant workplace is more than a best practice, it's a legal responsibility. For medical offices, complying with OSHA, Occupational Safety and Health Administration, regulations protects both employees and patients from potential hazards, reduces your legal risk, and helps you avoid costly fines. This guide outlines what OSHA compliance means for medical practices, the required training and documentation, and how to stay current with evolving standards. What is OSHA and why does it matter in healthcare? The Occupational Safety and Health Administration, OSHA, is a federal agency that ensures safe working conditions by enforcing safety standards and providing training and oversight. OSHA is especially critical in healthcare settings, where staff face unique risks like exposure to bloodborne pathogens, sharps injuries, chemical and drug hazards, radiation and laser risks, workplace violence, slips, trips and falls, ergonomic injuries from lifting patients or repetitive motion. According to OSHA, healthcare workers experience more workplace injuries than workers in construction or manufacturing. OSHA requirements for medical offices. Medical offices are required to implement safety measures, train staff, and document compliance efforts. OSHA may inspect your facility at any time, especially following a complaint or incident. Your office must identify workplace hazards and create a written exposure control plan, provide mandatory OSHA training for all staff, maintain training records for 3 years, ensure proper use of PPE, personal protective equipment, follow bloodborne pathogens standard, post required OSHA signage like Form 300A, prepare for emergency action and fire prevention. OSHA training requirements for medical offices. OSHA mandates job-specific training for all healthcare employees, including doctors, nurses, front desk staff, part-time workers, and interns. Training must include initial and annual retraining, especially for BBP standard, documentation of attendance, trainer credentials and materials, hazard communication, e.g. how to read labels, SDS, infection control and PPE use, proper sharps disposal and spill response, ergonomic safety and patient handling, workplace violence awareness and prevention. Failing to train just one employee can result in fines. OSHA's bloodborne pathogens standard, what it requires. This is one of the most enforced standards in medical offices. Your medical office must develop an annually update and exposure control plan, use universal precautions when handling bodily fluids, offer free hepatitis B vaccinations to exposed employees, train employees on how to prevent exposure to blood and OPIM, other potentially infectious materials, ensure proper sharps disposal, container labeling, and spill cleanup protocols, maintain accurate injury and exposure records. OSHA and medical waste. What you need to know. OSHA also regulates sharps disposal, labeling and color coding of biohazard containers, use of puncture-resistant, leak-proof containers, storage and transport procedures for regulated waste, employee training on waste handling, explore compliant medical waste disposal services. OSHA compliance checklist for medical offices. Use this checklist to evaluate your practice's OSHA readiness. Written exposure control plan, updated annually. Staff trained on BBP standard within last 12 months. Documented OSHA training logs for all staff PPE available, and used properly. Sharps disposal containers properly labeled and replaced. Safety data sheets, SDS, for all hazardous materials. OSHA Form 300, 300A, and 301 maintained, if 10 employees. Emergency exits, eye wash stations, and fire extinguishers checked. Workplace violence prevention plan in place. Incident and exposure logs maintained. Who is responsible for OSHA compliance? Every medical office should assign an OSHA compliance officer, typically an office manager, safety coordinator, or senior administrator. This person oversees annual risk assessments, training coordination, injury log maintenance, vendor safety verification, e.g. cleaning or waste disposal companies. OSHA fines apply regardless of practice size. Solo practices and small clinics are not exempt.
FAQs about OSHA in medical offices. Q. How often is OSHA training required for medical staff? A. Bloodborne pathogens training must be completed annually. Other safety training depends on job duties and changes in workplace hazards.
Q. What are common OSHA citations in healthcare? A. Missing BBP training, failure to use PPE, improper sharps disposal, lack of documentation, and incomplete exposure control plans. Q. Does OSHA apply to front desk staff? A. Yes. All staff who may come into contact with patient information, waste, or other hazards must be trained. Q. Is an OSHA manual required in a medical office? A. Not formally, but having a written safety policy, training logs, and documentation serves as your internal OSHA manual. Key takeaways: OSHA compliance in medical offices. OSHA compliance is mandatory for all healthcare providers, including small practices. You must provide annual training, especially for bloodborne pathogens. Maintain documentation of all OSHA training, incidents, and safety plans. Common violations include lack of PPE use, improper sharps disposal, and poor training documentation. OSHA also regulates medical waste handling, labeling, and storage. Every medical office should assign a compliance officer to manage ongoing OSHA requirements. Failing even a single OSHA requirement can lead to fines, legal liability, or patient risk. Bundling OSHA training with services like medical waste disposal can reduce costs and simplify compliance. Need help with OSHA training or compliance services? TriHaz Solutions offers OSHA-compliant medical waste disposal and can help you stay on top of federal and state regulations. We also provide guidance on compliance training and safety documentation. Request a free compliance consultation